Alpha-2 adrenergic receptor stimulators. The alpha-2 adrenergic receptors are unique because the receptor stimulation reduces sympathetic outflow, in this case from the central nervous system or CNS. This results in a lack of norepinephrine production, which reduces the blood pressure, so it works in the presynaptic nerve terminals. Alpha-2 in the brainstem and periphery inhibit the sympathetic activity. So it stimulates alpha-2 receptors in the brain, which decreases the sympathetic outflow, therefore decreasing the fight response, which decreases vasoconstriction. In addition, it also decreases the production of norepinephrine and decreases the renin activity, which results in vasodilation and decrease in blood pressure. Therapeutic effects include decrease in blood pressure, decreased constriction, therefore decreasing the resistance and afterload. It helps with pain control, alcohol, opioid, and tobacco withdrawal management. Some indications include hypertension, and off-label uses include migraine headaches, pain, and withdrawal symptoms. They are also used for anxiety. Precautions include concurrent use of multiple drugs affecting blood pressure, recent MI because of the potential for severe hypotension, and chronic renal failure and liver dysfunction. Precautions include concurrent use of multiple drugs affecting blood pressure, recent MI, chronic renal failure, and liver dysfunction. Some contraindications include acute heart failure and concurrent use of monoamine oxidase inhibitors. Monoamine oxidase inhibitors are powerful antidepressants, so taking alpha-2 adrenergic receptor stimulators can potentiate the effect of monoamine oxidase inhibitors. Side effects or adverse effects include orthostatic hypotension, fatigue, dizziness, and syncope. So this is usually not first line due to the high incidence of unwanted adverse effects. Nursing actions include monitoring of the heart rate and blood pressure. Also, take note that it's also available as oral, topical, and epidural routes. Just remember though that the patch cannot be stopped abruptly due to the rebound hypertension. So if somebody's on a patch, they had to be tapered off. Some patient education, definitely talk about the drug, the side effects, blood pressure monitoring, hypertension symptoms, other drugs which may interact or affect, and definitely compliance. So if there's a possibility of rebound hypertension, we need to make sure that the patients are actually compliant with their medications and make sure that they're taking it accordingly every day, even when they're feeling better. So it is important to emphasize that they just can't stop it, let's say the next day, because their blood pressure is a lot better than it used to be. Those medications need to be tapered off. Example of drugs in this class include methyl-dopa. You don't have to know this, but it's just a good FYI. This is taken during pregnancy, and the medication that you absolutely have to know for this class is clonidine or catapres.